Hi guys, welcome back to my channel. So as many of you know that I have done my graduation from Yerevan State Medical University, Armenia, and for that we need to clear a final exam that is known as a state exam or the GOS exam जिसको हम बोलते हैं. So the problem with that exam is problem for 2022 batch is the pattern that was followed in 2018, 2019 was not followed in 2020, 21 due to the COVID, but in 2020 they're again bringing back the old pattern. अब जो आप लोग MJ seniors हैं, they are unfortunately not having an idea about that pattern. That's why I'm getting multiple queries and thought of making this video. We'll try to keep it short and crisp. Okay. First of all, the exam is going to be in 3 parts: practical, MCQ, and then last is going to be the Viva. Practical exam जो होगा, for all the 3 subjects, you're going to have the practical exam on the same day. How to go for that exam? For Ops and practical, what all things that you are doing in your this thing, what do you call the simulation center, like fetal heart sound calculations, the delivery of the baby, normal vaginal delivery, and the breech delivery. All those things you need to do. And then you will also have the questions for the vaginitis, the candidal, bacterial, trichomonal. For that, they will give you certain reports. Those reports will have the culture reports of the sample culture or anything like that. So on the basis of that, you have to explain that. You have to confirm the diagnosis on the basis of the reports. Reports are going to be in Armenian, but don't worry, you can ask them for its English translation. So you can easily answer that. Then coming on to the surgery. For the surgery again, you need to surgery practical. I mean to say, for that, whatsoever they have taught you in that simulation center, the various techniques: IV injection, IM injection, suturing techniques, vertical suture, mattress suture, this that suture, RT insertion, catheter insertion, pigtail catheter insertion, pleurocentesis or something, जो भी होगा कराया होगा. Whatsoever is there in the syllabus, you need to perform that. At least not perform, just tell the steps should be proper, including you need to wipe with an alcohol swab. Yes, including all those steps you need to answer. For the medicine it's very easy. You need to diagnose the ECG. There are 2021 ECG saved in the university system. You are going to have the questions from those 2021 ECGs only. आगे पीछे नहीं जाना है कुछ उसके लिए. Palpation, percussion, what all organs are present in what all quadrants, like that. Okay. So whatsoever you're doing in your simulation, वो as it is आएगा. So for that, go and practice at simulation centers once or twice. For surgery, that laparoscopic machine. Okay. Now about the resources for all those subjects. Okay, so सबसे पहले let's begin with surgery. For surgery, what you need to use is the university handbook, and जो content university handbook में नहीं है, for that you can refer to Manipal Manual of Surgery or S-Das. I would prefer Manipal Manual first. जो Manipal Manual में भी नहीं मिलेगा, for that I will go to S-Das, because S-Das is something yet too boring, just like some other books of some old writers. I don't like that book at all. ठीक है. So surgery MCQs के लिए ना basically क्या करना है, you need to be thorough with the university book. Majority of the questions are going to be from the university book. surgery के लिए. So basically for the Viva, you don't for the MCQ you don't need to prepare separately. ठीक है. जो आप लोग Viva के लिए prepare कर रहे हो, keep on preparing that only. The questions for the MCQs are going to come from those topics only. You don't need to prepare separately. So with that, I have answered one question. Do we need to prepare separately for MCQ exams? Another question: how is MCQ exam related with Viva? So I have answered these 2 questions over here. You don't need to study separately for MCQs. You just study for the Viva. Okay. So those were the sources for surgery. For the surgery, it is just like for the surgery Viva, if I would say, for the surgery Viva, the thing is, they can ask you anything. For the surgery Viva, what they basically need to know is the classifications. They are very fond of listening to the classifications. Don't miss out on any classification. And try to read from the Manipal Manual of Surgery about the new techniques that are being performed. Okay. The thing is, they want to hear about the new techniques. But unfortunately that are not in our book. So that's where you will score, that's where your score drops a little bit for surgery. So surgery book is too raw, I know. My basically what I did was, I cannot study from any book, be it any book. I have to make notes. So I just made my notes and I studied surgery from that. Like basically I did that for all the subjects, not just for the surgery. So surgery ke liye the thing is, again I'll repeat, university book, Manipal Manual of Surgery, S. Das. Do these three and you will be, at least you will be able to clear it with good marks. I would say in all the three practicals I got more than 9. In surgery theory I got 6 point something, and in surgery final I got around 7, and my final average also came out to be around 7. Okay, now coming on to the next subject. The next subject is medicine. For medicine there are multiple resources. The primary one should be George Matthews, not Harrison's. I repeat, primary one should be George Matthews, not Harrison's, if you want to pass with good marks. And you know, what is Hasmik notes? You must have heard the notes of the Hasmik Zakharian ma'am, that photocopy notes that are being circulated. That is nothing but George Matthew. Hasmik ma'am is fond of George Matthew, but like no teacher can tell you to study from some book that is not a textbook. That's why they will keep on stressing on the fact, study from Harrison's, but study from George Matthew. Second source, ECG Mid AZ. Third source, Davidson. Fourth source, Medscape. And the fifth source is Harrison's. Harrison's only for the thing that is not there in any of the above mentioned resources. George Matthew, you just have to directly remember whatsoever there in it. Don't do plus minus with it. Please don't please don't study from YouTube and then add on from George Matthew. No, you will not pass. Study from George Matthew. If you're not able to find some topic in George Matthew, then only jump to some other resource, and that should go only to the resources that I have mentioned. In order to clear the concepts, yes, you can refer to any videos on YouTube or anywhere, but in order to answer your exam, George Matthew, George Matthew, George Matthew. ECG Made Easy for the ECG for the practical. Davidson's for some little bit of stuff. The second major source that I used was Medscape. Full cardiology I did from Medscape. Medscape is an online encyclopedia, medical encyclopedia. It is not some shit source. Shit source is something like Wikipedia, something like Mayo Clinic. Mayo Clinic is basically made for layman, not for the doctors. So Medscape is something that you can vouch on, that you can basically say that it's an authentic source. That's how I studied my for my medicine exam. And yes, sometimes I also had a question, like the question says pulmonary embolism, diagnosis and treatment. They have not asked about pathophysiology, signs, symptoms. Should I answer that or not? You do not need to answer that if they have just asked for the diagnosis and the treatment. Firstly, answer diagnosis and treatment. Wait for them to ask the cross question. If they are asking it, then only you have to answer pathophysiology or signs, symptoms, or anything extra basically. And you don't have to study extra for that, because all these things will get covered. Like when you will get that Viva question list, you will have a question 1, pulmonary embolism, definition, pathophysiology, signs, symptoms. Question 2, pulmonary embolism, treatment, diagnosis and treatment. So obviously that thing will get covered in some other question. You don't need to study outside your question list, outside your topic list. Basically, that is not a question list that you get, that is a topic list, I would say. So that is something that you need to focus on. Just study the way I am telling. Pakka you will score good marks. Okay, for medicine MCQ, and it is just going to be out of the topics that you are preparing for the Viva. You don't need to study anything separately. In medicine MCQ, I got either 8.2 or 8.4. In medicine Viva, I got 10. Yes, 10. In medicine and surgery panel, I had Dr. Armen Minasian from Muradian Hospital and two other people, those who I was not familiar with. And this exam is basically, as all of you know, is conducted by the Ministry of Health and Ministry of Education of Republic of Armenia. So you will also have one representative from the ministry sitting basically not in the panel. He might not even sit in the panel. He might sit on the opposite side, but he will be present in the hall. You will have your audio video recording going on. Okay. Now coming on to medicine panel. Medicine panel, I had Anna ma'am, the old dean ma'am. Okay, Anna ma'am was there, Hasmik ma'am was there, and two more people. In medicine, I had two more people. One was a cardiologist from Moratsin Hospital. I forgot the name. I guess her name is also Anna only. I don't remember. Okay, and one more. I don't remember who was the fourth one. Was, I guess, Elizabeth ma'am. Okay. Now coming on to the Obsgyn panel. For Obsgyn panel, I again had a dean ma'am. Yes, the Anna ma'am. I had Babloyan ma'am and one more. Okay, Babloyan ma'am was really supportive. Don't worry about it. Okay. So coming on to the Viva, I have already mentioned about the Viva. Okay, now coming on to the Obsgyn. For Obsgyn, sources should be Datta for Obs, Shaw for Gynae. कुछ भी बाहर से नहीं required. Don't study anything. Don't waste your time. उसी में से आएगा जो आएगा. Except for dysfunctional uterine bleeding. For that topic, don't study from Datta. Datta mein there's a mistake in that topic. Even the latest editions, study from anywhere else. Any internet source, anything, just study that one topic from somewhere else. Don't. Okay. Basically, if you will answer from these topics, then only you will be able to score good marks in Viva. Because obviously, teachers expect you to answer from the textbooks. Because for medicine, nothing is above the textbooks. SlideShare pe there is content. One of you have also asked me, sir, can we prepare from SlideShare? I would say no, because those slides are basically very crisp and from the textbook. That will not give you a proper knowledge, and that's why that's why you will not be able to satisfy the examiners. For that, you need to study from the textbooks only. So Obsgyn follows the same pattern as medicine for MCQ and for the Viva. Whatsoever is there for the Viva is going to come out in MCQ. Even in surgery, that is true. But in surgery, for MCQs, like I would say for the surgery MCQs, out of 50 MCQs, I would say ki 70 to 80% are directly going to be from the book. Maybe like this or holding your ear like this. But there are going to be some questions which are going to test your real knowledge. I would say book se thoda sa hatke hoga wo. So you cannot basically be sure that will you be able to answer them or not. So that's why for surgery, जितना book में है अच्छे से याद करके जाना, so that you are not going to make any mistake in those questions. So and important topics. One of you have also asked me, please tell the important topics. Unfortunately, I don't remember the important topics right now because it's been 4 years since I last gave my state exam. Then another question was how basically the majority of the question that I got was how to prepare for MCQ while preparing for Viva. This question was asked by various people, obviously framed in different manner. How is MCQ exam related to the Viva? If I'm studying from Viva, how can I answer MCQ? So I have answered that. Study for the Viva only, and MCQ you will get from only those topics only. Other sources, no. The sources that I have mentioned are the trustworthy sources. Don't go for any online presentation or something. You can go for the videos in order to understand the concept, but you need to remember what is there in the books. Specifically, George Matthew, surgery book, university handbook, Ops, Gynae, Datta, Shaw. Medscape can be trusted only as a non-textbook source because that is an accepted medical encyclopedia. Don't go for Mayo Clinic. Mayo Clinic is made for the layman. Okay. What to answer in Viva? Done. Revisions. Coming on to the revisions, basically the state exams, it usually begins during the last week of month of May. So you should be done with your first preparation by, I would say, April mid. Okay. Starting to mid-April. Then till 10th or 15th of May, you should be done with your first revision. You should be done with your second revision before giving the MCQ exam, and in between the Vivas you will have a gap of 1 week. Yes, all the practicals are going to be on the same day. Then after a few days, maybe 2, 3, 4, you're going to have the MCQ. MCQ exams will be like for 150 questions, you need 50 per subject, and you need to score 26 individually. It will be for 150 minutes. You will have your timer on ongoing on your screen. You will also get your score subject wise going on your screen. Yes, the questions won't be mixed in the sense you will get set of 50 questions from a particular subject together. That might vary. Some person might get surgery, obs, medicine in this pattern. Some person might get obs, medicine, surgery in this pattern. So that pattern can vary. That has been meant so that you won't look at the next computer and try to answer. As well as in the set, the sequence of 50 questions for a particular set is going to be different from your partner. Even if, yes, firstly, the person sitting next to you won't have the sets in the same pattern. For example, you get medicine, surgery, obs gyne, he will not get in the same pattern. And even in medicine, your question number 1 might be his question number 16. Your question number 50 might be his question number 3. Any random mixing is going to happen. So don't cheat. Do not cheat. Okay. Well, I hope I was able to answer you. For more queries, feel free to ask me questions on my Insta. If you have liked this video, don't forget to like, comment, share and subscribe. All the best for your state exams. Don't party right now. Yes, don't party. Exams are just around the corner. 11th hour is already going on. Prepare well for the exams, and I hope to see you soon in India doing your internship after clearing your FMG exam successfully. Bye bye. Take care.